So this is how we used to treat them. So their face was fully enclosed, it went down over their shoulders as well, and then it's much smaller, completely open on the face and then on the shoulders, so it's far less restrictive.
SGRT system's better for patients because it means that we don't have a marker on the patient or a tattoo, which can be a very constant reminder for patients that once they've undergone treatment and they are maybe 5-6 years down the line and they've had that all clear perspective, or they're just having in a routine follow-up, that they don't have that kind of physical reminder that they've had cancer treatment with the tattoos. And it's not just one tattoo for certain patients, like head and neck, it used to be one on the centre and one on the side, either side as well. So for some patients that was 3 tattoos that were physical reminders that they've undergone cancer treatment. So it is much better in that sense that they don't have that reminder. But also it means that the patient's treatment, because we use this system, can be quicker, which we've seen it can reduce time in the treatment position, which might not always be the most comfortable. And from a head and neck perspective, it's meant that we've been able to reduce the amount of mask the patient's wearing. So what that does is it means that patients who are claustrophobic can potentially tolerate the treatment, whereas in the past some patients would need drugs on a daily basis to relax them, or even patients would decline treatment. So the benefit has been massive. So the radiotherapy machine uses high energy X-rays to emit electrons. They speed them up really, really fast. It hits a big kind of metal target, and then that produces what we call photon X-rays, which then are directed towards the patient. And when they interact with the patient's tissue and the DNA, it causes reactions that cause electrons that then damage DNA, which is beneficial for cancer treatment. Somerset unit for radiotherapy equipment provided the funding for the SGRT system, which we've implemented, and over time we've been able to implement the head and neck process through a head and neck team. Main patients that we see are breast and prostate cancer patients. We also treat thorax, esophagus, we treat skin lesions, we treat head and neck patients of all different varieties with regards to the tonsil, the base of the tongue, the larynx, sometimes we treat the parotid gland, and then we can also treat patients in a palliative sense as well, so that's relieving their symptoms, not in a curative intent. We set margins on the SGRT system, so if the patient was to move more than 3 millimeters or even 2 millimeters for our head and neck patient, the machine immediately cuts out until the patient's relaxed back down into that position, or the radiographer has prompted the system to restart as we're happy with the patients back in the correct position. Correct position is really important because we are treating the same place. Radiotherapy is the same treatment delivered to the same location every single day. For some patients 1 day, 5 days, 4 weeks, 6 or 7 weeks. So because we are treating the tissue to a very high dose to kill the cancer, that also means that all the healthy organs or healthy tissues around it, if there was any inaccuracies, could mean that we miss the cancer. We treat the healthy tissue and the patient just receives or undergoes side effects and doesn't get any cancer treatment benefit.